Hi there, everybody. Susan and Irina here again, and today we're gonna talk about electronic health records and AI. First of all, in the good old days, remember when EMRs first came out? And gee, if you had a question, what did you do? You
You
called,
called the doctor and waited for days for the answer.
right? And you sat by the phone because also didn't have, portable phones back then. So you sat at home waiting for the doctor to call or the nurse to call you back, right? And sometimes those exchanges could go back and forth quite a bit. And so then we discovered that these EMRs have portals. And so patients started saying, wow, this is great. Now I could just message my doctor. I don't have to wait and call them. And so, which everybody loves now. Everybody uses, patients use it, patients love it. However, the end users are the nurses and physicians responding to those messages, right?
Yep. And Susan, I don't know if you know, but I read that the average patients panel for a primary care provider is about 2,500 patients. That's what their panel of patients.
Sure.
And of course, some see them once a year,
Right.
some see them every month, right? But now imagine that these providers are getting maybe sometimes hundreds of messages per day, because it's amazing for us as patients that we can just, message our provider. But on the back end, they're seeing 25 to 30 patients a day and now have to answer 100 messages. So we want to show you a study that was done. And Susan and I opinion, this is where AI is really being used to put in a good use, because a lot of people are still so scared where AI is being utilized to make clinical decisions, or people are saying, oh, this is going to replace nurses or doctors. This is where the study was done to see if AI solution can look at portal messages in the EMR and actually label them and see what it can do. So what I like about it is, I'm just going to read this because it says that they developed natural language model that accurately labeled inbound EHR messages from patients using a pre-trained classified with fine tuning based on clinical feedback. This is where we want to bring it back to us nurses, because there's going to be some vendors that will come to the hospitals or clinic with a very built-in solution and say, we know exactly how to classify the messages, but you need your clinical feedback, because you know that this patient every month is asking the same question, or this patient never emails, and when that patient emails, we need to take this seriously. We need nursing involvement. But basically what they did is they pretty much, they divided, it was about 800 or 900 messages, divide them in a control and an intervention group pretty equally. And out of the intervention group, what they found, and remember, this is not decision making per se, this is labeling. So if patient will say, for example, I need a medication refill, this would be labeled maybe as medication refill, right? So maybe physician doesn't even have to look at it, or provider, because it's a chronic medication that patient is on. Or patient will say, I need a lab result, call back, or I need a referral. So they labeled it. Based on that, the study found that there was 83% reduction in the time to the first interaction. So imagine that instead of taking a day, it's maybe now taking 2 hours. 83%, it's huge.
Yeah.
Then it was 84% reduction in time to conversation resolution. Meaning, remember, again, good old times, you call, doctor calls you back, or nurse calls you back, then you call back again. You're like, oh, wait a second, I forgot to ask this or that. So sometimes the conversation did not resolve until 3 or 4 conversations. This is 84% reduction in the resolution time. And where I think the kicker is, there's 40% reduction in the total number of staff interaction after application of intervention. And what it means is, after, let's say this was I don't know, medication refill, an intervention was made, the refill was sent to the pharmacy. 4 out of 10 times, that clinician, the nurse or a doctor, did not have to call the patient again. It was done. And again, we'll link this article, but we just wanted to highlight that, unless you're living under the rock, you hear everywhere of nursing burnout, doctors burnout. We burn out not because we are tired of doing the job you love. You burn out because you're tired of doing the job you hate or you don't like. And things like answering phone calls, things like answering messages, that's not something that a lot of people enjoy doing. So yes, if your job is, if you're, let's say, a triage nurse and your job is literally, it's a virtual job, maybe you work from home and you're happy that you work from home, but your job is to answer messages 8 hours a day, I think you're going to get burned out, right? You want to answer messages that are fun, like interesting, something that you can sink your teeth in, like, oh, that's something I can help the patient with, not a very routine things that doesn't need your level of education to do. So again, we'll link to the show notes, the article, read it. If you're involved in your clinics or hospital, this is something that you can advocate for reviewing and adding to your workflow. But again, nurses, please get involved with AI and stay tuned for the next article that we'll discuss.
Yeah. Visit us at www.nursesforai.org. See you next time.
Bye.